Hello, everybody. I'm glad you could make it tonight for this very interesting talk we've lined up with young humanists on vaccine hesitancy and misinformation. So I'm going to introduce myself. I'm Rachel Taggart Ryan. I am the campaigns officer at Humanists UK, and I work on our human rights and equality issues and our medical ethical issues. And that's one of the reasons I'm here chairing this meeting tonight. Before we begin, I'd just like to kind of give a brief introduction to Humanists UK, of which Young Humanists is a part, and what we've been doing as an organisation to counter vaccine hesitancy. So really, to begin with, as humanists, we trust the scientific method when trying to understand how the universe works. This is one of the fundamental principles underscoring the humanist worldview. So following this approach, we at Humanists UK, it's led us to support the uptake of the COVID-19 vaccine. The published data on the efficacy of the authorised vaccines, which have been through the random control trials and peer reviews that we would expect of any vaccine as it was being launched onto the market, we have therefore embarked upon an awareness campaign to encourage the non-religious to get vaccinated. We have started in a position of strength in this regard, as the overwhelming majority of humanists were already planning on taking the vaccine. Our membership survey last month showed that 95% of our members and supporters, 93% of all of our contacts, indicated that they would take the vaccine, and most expressed near certainty that they would choose to do so. The percentage who were not sure or not likely to take the vaccine would therefore include the 1% with known allergies or people who would otherwise be unable to take vaccines. As we've kind of gone down into looking at this particular group, the non-religious who are vaccine skeptical, it was very hard to analyse because looking at their kind of demographic profiles, because the sample sizes are actually quite small. Those who are less likely to get vaccinated are to some extent women and younger people, those who are on lower social grades and less educated, but most significantly, they are people who are the hardest to reach because they don't engage with news media, television or social media. And we also discovered they're least likely to vote. Going beyond those characteristics, their favourite humanists tend to be Stephen Fry, Alice Roberts and Jim Al-Khalili, who come up as everybody's favourite humanists overall, whether you are vaccine sceptical or not. So starting on this basis of how we would approach trying to persuade this group, we decided upon really going for big name humanists who kind of had the broadest sense of appeal. So at the moment we are working on publishing a joint letter from many high profile humanists, including Stephen Fry, which we should be publishing very soon. We've got over 60 signatories from amongst our patrons. And we're also planning on working with other religion or belief groups to produce similar joint letters regarding vaccine skepticism in and amongst other religion and belief groups and amongst faith leaders where there might be some concerns. We have 3 really excellent speakers lined up for you this evening. Without further ado, I'm going to bring on our first speaker, who is Dr. Richard Clarke, a health psychologist at the University of Southampton. He did his PhD with the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. He previously researched information-seeking behaviour of women as they made their decisions regarding antenatal pertussis vaccines, and is currently involved in 2 very interesting research projects. The first looking at preventative behaviours and long-term symptoms related to COVID-19, what has come to be known as long COVID in the last few months. And his second interesting project is a survey looking at COVID-19 vaccine beliefs and their uptake in health and social care professionals in the UK. All right, without much further ado then, I will bring in Dr. Richard Clarke.
Thank you, Rachel. That was a very, very nice introduction. It's really interesting to hear that you're also doing basically the same research that I'm doing at the moment, which is like asking massive groups of people to try and fill out surveys to try and work out whether people are likely to take the COVID-19 vaccine. So it's good to see that you're like hitting the same sort of points that we are within our surveys as well. We're finding certain demographics are more likely to refuse the vaccine than others. So a little bit of a background about me. So I'm trained as a psychologist. So I'm a research psychologist by training. So I did a master's where I learned how to perform experiments in psychology. So I was heading down a pathway of kind of neuropsychology, where we were looking at how people were just kind of perceiving faces and how different biases occurred there. So this is where I learned kind of the kind of core tenets of science, and that's the kind of thing that's kind of stayed with me. And then over time I've kind of built in a kind of health element into my research. So when I was choosing a PhD topic, I wanted to pick something that would have some sort of real world use to it. So I found this group at the London School of Hygiene and Tropical Medicine called the Vaccine Confidence Project. And I ended up doing a project with them which looked at uptake of the pertussis vaccine, so whooping cough, in pregnant women. So some of you might not be aware of this, but pregnant women are asked to take 2 vaccines during their pregnancy. So one of them is an annual flu vaccine, but there's also a vaccine for pertussis. So there's been quite serious outbreaks of pertussis over the last 5 or 6 years. When a baby is born, it takes about 3 months until they're able to take their first dose of the pertussis vaccine. So what we do in this country now is that we vaccinate pregnant women, and they pass on immunity to the child for the first 3 months of life until they can get the vaccine for themselves. So as you can imagine, that's quite a difficult demographic to work with for vaccines. Obviously, like, it's all to do with, there's kind of like a rule of thumb that women won't take medication during pregnancy for fear of adverse effects from it. So we've got quite a barrier to overcome with that group. So a lot of my work was kind of looking at how women would kind of conceptualize the choice of vaccinating during their pregnancy, and then how they would go out and kind of find information and let that inform their decision. So we might touch on that a bit later, but that's the kind of work I did during my PhD, and then I left my PhD. I graduated about this time last year, and I was all ready to kind of move on and look at different topics for a while. So I'm a health psychologist. I don't want to just look at vaccines. But then something happened which was very vaccine relevant. So I got kind of brought back into this kind of research. So earlier this year, I looked at, with my team at the London School of Hygiene and Tropical Medicine, we looked at kind of issues around parents taking their children for routine vaccination during the first lockdown. So we noticed that after that first lockdown hit, a lot of parents were missing their child's first or second vaccine doses for various campaigns. And that was kind of concerning. We wanted to understand that problem a bit better. So we did a survey that looked at that, and we found that it wasn't really that they were concerned about COVID. They still saw the vaccines as a very important thing to have for their children. It was worth going out and getting the vaccine sorted, but it was more kind of administration issues. So like healthcare systems being kind of overwhelmed with shifting to kind of a lockdown practice. So that's the work we did over the first half of the year. And then I'm now on this project at Southampton where we're trying to understand long COVID a bit better. So this is symptoms of COVID that last for longer than 3 months. So there's not very good data on this at the moment. It's not, say, on the BBC News that in the evening you don't get the number of people with long COVID, but it is estimated that about 1 in 10 people that have a severe case of COVID have symptoms that last longer than say 3 or 4 weeks. And that's quite concerning that we're not kind of accounting for this in any of the decisions that we're making, really. So we've got a project that looks at that, among other different things in this survey, and a lot of my job is trying to kind of recruit people to take part in the survey, and then you know, just making edits on the survey. Really, I'm just a bit of a data monkey on it, but it's looking quite promising, and we should get some results of that, you know, maybe in the next few months, probably when it's too late for them to be any use. That's usually the way with academic research at the moment. And then finally, the project that I'm on at the moment that I've been kind of focusing on today is we did a survey of healthcare professionals and social care workers. And as you can imagine, uptake of vaccine in these populations is really important. We really want to understand why, if anyone within those groups are refusing a vaccine, we would like to understand why that is. So we can go into that in a bit more detail later, but yeah, we've got some results of that coming out this week, so that should be quite exciting. But yeah, that's kind of the basic overview of what I do and who I am. So I'll pass over back to Rachel, I guess.
Okay, many thanks, Richard. So I'm going to bring in our second speaker, who is Miriam Kazim-Malaki. She is Policy and Research Manager at Sense About Science. Beginning her career working in the UK Parliament and local government, she's now developed a passion for engaging people in subjects that might otherwise seem inaccessible for them. Miriam delivers Sense About Science's policy activity, including evidence weeks and transparency of evidence. So I'm going to bring her in now. So Miriam, please come to the floor.
Thank you, Rachel. So as mentioned, my name is Miriam Kazim-Malaki. I joined Sense About Science as their policy and research manager in summer last year, so still relatively new. But prior to that, I spent 5 years working in public-facing roles in Parliament and the Council at various levels. So my experience is a little bit different from the other speakers, I think, today. So I thought I'd give you a little bit of a background on Sense About Science and what we do. So Sense About Science is an independent campaign charity that challenges misrepresentation of science and evidence in public life. We aim to inform science-based policy and advocate public interest in science policy and evidence. A main part of my role is bringing researchers and parliamentarians and the public together to share knowledge and insight on the role of evidence in policy-making decisions. One way we do this, as mentioned, is through our annual event Evidence Week in Parliament, which is a great event. We get researchers in, they do 3-minute speed briefings to parliamentarians. This year we involved about 100 politicians and their staff and everybody, so it was quite a big event. Normally obviously it's in Parliament, but this year on a virtual platform like everything else. So we're obviously all here today to talk about vaccines and hesitancy in the context of COVID, but misinformation and misunderstanding are of course not new. So for almost 20 years, Sense About Science has been working to tackle this. One way we do this is by working with the public and experts to create guides and resources on topics that are often misrepresented and misunderstood in public discussions. Hesitancy often comes from a lack of confidence, so we aim to equip people with the tools to know where to start. One example of this is a booklet that we originally published in 2005 titled "I Don't Know What to Believe," which explains how scientists represent and judge research using peer review processes and how the public can make sense of these science stories. As an organisation, we aim to equip people with the skills to ask critical questions of what they are told, whether they're hearing this information from people who are vaccine advocates or from people who are sceptic of vaccines. We as an organisation acknowledge that people have the right to be hesitant and sceptical about newly and rapidly produced vaccines, but that does not mean they're not safe. This is why we champion transparency. We know that we need the data to understand the evidence base to make informed decisions. In 2013, Sense About Science started our All Trials campaign, which calls for all past and present clinical trials to be registered and the results reported. The campaign found that trials with negative results were twice as likely to remain unreported as those with positive results. This meant that people who were making decisions about our medicine didn't have full information or access to the information about the benefits and risks of the treatments that we use every day. Science communication around COVID-19 has obviously played a huge role in shaping the views of society towards vaccinations. Vaccines are one of the most successful medical measures that save millions of lives every year. Obviously, we know that. Despite a large portion of the population being open to vaccines, a large number of individuals are hesitant to the vaccine, largely due to, we think, confusion, fear of uncertainty, and misinformation in the media. So for us, vaccine hesitancy can be overcome by seeking evidence and encouraging transparent communication of science in a way that is understandable and relatable for the public. Replacing hesitancy with public confidence is key. So not just confidence in experts and politicians, but confidence in evidence and confidence to be able to question and challenge that evidence. So it's kind of something that we're working on at the moment. So just a bit of background.
Thank you very much, Miriam. Our final speaker tonight is Michael Marshall, someone we've worked with for many years at Humanists UK. He is the project director of the Good Thinking Society. This is a charity which investigates and challenges pseudoscience. He is also the editor of The Skeptic magazine, and throughout the pandemic, he has worked with publications across the media, really, to expose anti-vaccine misinformation. Typically, this has been shared by homeopaths, chiropractors, psychic healers, all the way up to out-and-out COVID deniers and conspiracy theorists. One of his biggest stories actually led to the suspension of the Society of Homeopaths and the removal of anti-vaccine content from social media. He also runs a podcast called Be Reasonable, in which he tries to understand what leads people to hold anti-scientific positions, how do they support those views, and how they encourage others to believe them. For the last few years, he has also investigated the fringe movements in conspiracy theories, such as the Flat Earth conspiracy and sovereign citizen movements, and how they really have played their part in radicalizing people into holding extreme health beliefs, such as miracle cures and anti-vaccine rhetoric. Please do welcome Michael Marshall.
Well, thank you so much for that, Rachel. Thank you, everyone, for joining us. It's a pleasure to be here. So yeah, as Rachel mentioned, so I'm the editor of The Skeptic magazine, and I work for a charity, Good Thinking Society, which is a skeptical charity. And it's probably worth just highlighting at the moment that we're probably going to use the word skeptic in several different ways tonight. But when we use skeptic in the terms of The Skeptic magazine, we mean as in to investigate an issue, to follow the evidence, to ask questions and come to conclusions based on good reason, rationality, and evidence, which is obviously different to how people who would say they're skeptical of vaccines would characterize skepticism. But as Rachel mentioned there, I spent quite a lot of time since I became a skeptical activist in 2009 researching unusual ideas, mostly around the pseudoscience side of things, which maybe means I'm coming at this from a slightly different perspective from my two fellow panelists who are coming from obviously a very science and policy background. I sort of specialize in the stuff that's wrong rather than the stuff that's right, I think. And in the time that I've spent researching these unusual ideas and campaigning around stuff like alternative medicine, what I've found is we can often think of people who believe in these ideas as individuals who are making choices on an individual level. But often I think these ideas grow support networks and communities and even entire social ecosystems to support people in believing these ideas, to deepen their belief in these ideas and to have them persuade other people in their lives. And it becomes quite an identity position for actually quite a lot of people who are very ingrained in these areas. But from the outside, when you're not in those communities, it can seem like this is one single community, and therefore suggests there might be just one solution to it or one way of tackling that. But what I've noticed from spending a long time talking to people who are believers in all sorts of pseudoscientific ideas, from the mainstream pseudosciences of things like the anti-vaccine or vaccine hesitancy into extreme fringe stuff like flat Earth, QAnon type stuff. I think it's very easy to see them as one community, but they're actually separate communities within. That not all believers are the same. And I think before you start to tackle the issues that bring people to the level of belief that they're at, you have to first understand whether people individually are and what the strata of those belief systems are, and therefore what fixes might apply to each of them. And I think with anti-vax, for example, I think there's quite a few different layers of anti-vax. You have at one end the vaccine hesitant, the people who might say, you know, I don't know enough about it. The vaccines come around very quickly. How come we have a vaccine for this but not other stuff? The kind of reservations that you could see being based in an information gap. But then we have other parts of the movement, like the conspiracy theorist arm of the movement, who the reason that they're hesitant or outright antagonistic to vaccines isn't from an information gap, but because of an existing belief that the government can't be trusted, that big pharma can't be trusted, that Bill Gates is out to stick a microchip in your arm, that kind of stuff, which will be quite different from vaccine hesitancy. And then we've also seen this community of alternative medicine anti-vaxxers, which I think is quite substantial and worth really thinking about, because for a lot of those people, the reason that they don't want the vaccine is in part maybe a fear of chemicals, this chemophobia, or a big pharma mistrust, but it's also because they believe that they have better alternatives. So one of the reasons that a homeopath might be quite committed to rejecting the vaccine and persuading their patients to reject the vaccine is because they believe that they, in many cases, have a better thing than the vaccine. They have their homeopathic alternative. And so we see the anti-vaccine movement really split into subgroups, subcategories, subcommunities, and I think each of those requires a different treatment, a different set of attention, a different set of solutions. And we have seen an awful lot of anti-vaccine spread in the alt-med communities. That's something I've spent a long time tracking throughout this pandemic as it's been going on. For example, even from the start, we had the pre-existing belief in homeopathy that that homeopathy could cure autism. They'd use a thing called cease therapy, a form of homeopathy that they believed would cure autism. And because they think they could cure autism, they would therefore have to have a reason why people were becoming autistic that they could treat. And they blamed vaccines for that. So the vaccine, the antagonistic views towards vaccines were in there from the start. But having seen that already in the homeopathy community, the homeopathy industry, what we saw during the pandemic was the Society of Homeopaths, the most credible wing of homeopathy, actually appoint an anti-vaxxer to the position of standards director, of professional standards, to make sure that people are safeguarded, which is obviously an incredibly dangerous thing. And that's one of the things that we highlighted in the press. One of the most curious things we've seen actually through this is that those communities who may have been in the anti-vaccine movement because they were alt-med first, once they have seen the conspiracy theory side of the anti-vax world putting out misinformation, those two circles have started to blur a little. And we've actually seen, for example, those big lockdown marches and anti-COVID measure marches that were happening through London and thousands of people gathering in Trafalgar. We actually saw homeopaths promoting those particular marches and trying to get people along. So we're seeing a bleed between those quite extreme ends of the anti-vax world to sort of coalesce around the rejection of vaccine. We're seeing things like the well-being world, even yoga and online influencer worlds starting to adopt anti-vaccine stuff as a core part of it, and even conspiracy stuff as a core part of it. And I think when it comes to really try to tackle this, the angle we try to come from, where we spend a lot of time really digging into the misinformation, digging into the pseudoscience, is we first try to understand what it is that the particular vector of misinformation, or the particular person who might be vaccine hesitant, what it is that they're afraid of, what is their motivation, what's pulling them into this. Try and understand that as much as possible, and then use that understanding to influence how we then talk to people. You know, if they're scared, you can offer reassurance. If we can often see that the anti-vaccination movement has consequences, and we can assume that those consequences are intended, but actually the intentions of many people in the movement are actually surprisingly positive. They have the value that they want to protect people, but they're wrong about how they do it. So we can actually understand that their values might be in the right place, but their outcomes in the wrong place, and try to use that to try to demonstrate to people why they should check their belief in the evils of vaccines and actually start to follow the science on that. So that's where I really come at it, is from as understanding as much as possible the pseudoscience and how the misinformation has being spread around, what communities it's being spread around, and what are some of the motivations and factors that influence those particular super spreaders, you might want to say, of misinformation, and also the people who come to believe them. And I guess that's the perspective that I'll be bringing to the discussion tonight.
Thank you very much, Michael. It's very interesting. So first off, this is to all the panelists, but I'm going to particularly direct it towards Richard. What would you say is the state of public opinion regarding COVID-19 vaccine and vaccination program generally at the moment?
Yeah, I mean, it's incredibly positive. Like, we're seeing, a demand for this vaccine like, we haven't seen for other campaigns. So I'm reminded about, I don't know if you remember a few years ago when there was big demand for the meningitis vaccine after there was a couple of very high profile cases showing a child with meningitis and how kind of devastating that can be. We're seeing the same sort of demand at the moment, but because we all kind of have a good kind of awareness of COVID. So like, yeah, I think we're seeing, I saw some data recently that it's high 90% of over 80s have already accepted the vaccine, and like usually we'd be expecting to have to try and catch up with lots of people, but like a combination of a really effective strategy of getting the vaccine out and very high demand is meaning that this is going kind of spectacularly well. So like the kind of issues that we're thinking about is in 6 months' time, are people still going to be in such demand for the vaccine? So like people my age going to want to take this vaccine? Are they going to kind of, we generally talk about the 3 C's. So we got complacency, confidence, and convenience. So like, are people going to just kind of think, oh, I won't bother because the pandemic is mostly over at this point, so it's not really necessary, or I'm young, so it's not likely to be so bad, so why will I actually go out and get this? So that's kind of like the complacency side. But then to overcome the complacency, you have to make the vaccine as convenient as possible. So like, these are the things that I'm always thinking of way before I'm thinking about anti-vax. It's always access before anti-vax for us. So it's making it convenient, so that you need so little energy to go and get the vaccine. It's so that you can go to the supermarket and have the vaccine at the same time, like maybe even have it in pubs. It's like that kind of level of convenience is what we need to be able to kind of maintain these levels of uptake, because it looks like it's very possible that we could do particularly well with this campaign. But then you have to think about, well, if we're going to have these top-up vaccines every year, we're going to have to start planning ahead. We're going to have to start thinking about, how do we vaccinate an adult population when there's no COVID around? That's going to be the real challenge here. Like, people my age don't have vaccines for anything. So the last vaccine someone my age might have had would have been the HPV vaccine. We don't have a very good national flu vaccine program. We vaccinate high risk individuals, but we don't go through a kind of a mass flu vaccine campaign in this country. So we don't have that normal kind of everyday vaccination that we might need if we're going to kind of build that into a COVID campaign. So those are the things that I'm thinking of at the moment. But generally, like, I'm blown away. I'm like incredibly positive about this. That's where I am.
Yeah, just think of that, Richard. Do you think it's possible that the enthusiasm for COVID vaccines might actually then bleed into enthusiasm later for flu vaccines? Because we've all gone through a period where we actually really need a vaccine. Suddenly, the value of vaccines is very prominent in everyone's mind. Yeah,
exactly. Like, flu vaccine this year was particularly good. But we did have a message around that of not overwhelming the NHS, so go and get your flu vaccine. And it was like, people were just ready for a vaccine at the time. So it's like, I'll take any vaccine, it's fine. But yeah, like, hopefully that'd be great. I would like to see that. And like, any of us could have at any point walk into any point during flu season, you could have walked into your pharmacy and you could have paid some money, which is a barrier to this, obviously, and have the flu vaccine. But like, I gotta say, I don't have it every year. Like, I managed to get it through work one year, but like, you know, I'm very pro vaccines. It's not like I have vaccine hesitancy about that, but the barrier to getting that vaccine was just too high. Yeah, so like, hopefully this will mean that, like, a lower threshold. And the best predictor of future behavior is past behavior. So get adults vaccinating now, they're more likely to vaccinate in the future.
Miriam, I might direct this to you as well as the other panelists, but how should we, as humanists and as members of the public, really be communicating about the science and evidence so that we're encouraging people who might be hesitant to take that vaccine?
Yeah, so I think Michael had covered a lot of this earlier about this kind of understanding the underlying fears. So when someone's coming to you and saying, you know, the vaccine was developed too fast, or they've cut corners, or you know, it's going to affect my fertility, you need to get to the root of what their actual concerns are. You know, that's the fear on the surface, but there's always something deeper. There's always a deeper concern to that. So one of the things that we sort of talk about is talking to people about what evidence would they need to see to help them change their mind. You know, what would be the one piece of evidence that would change their mind, but also that kind of thing of trying to work out where they stand on some of the other conspiracy theories, so or other areas of hesitancy. So what is it, something that they've heard other people who are hesitant say that they don't believe in? So, you know, just kind of planting those seeds. What, you know, where is that misinformation coming from? One of the things that we're quite keen on is making sure that you're aware of the emotional aspect of it. So people who are hesitant, there's a lot of underlying fear and sort of resentment towards society and a lot of institutions. You know, that people who are hesitant more often than not are people who have society hasn't worked for them in the past. So it's people from maybe from BAME backgrounds or lower socioeconomic backgrounds who can see the society doesn't work in their favor. You know, they're not the ones in charge. They're not the ones who are making the decisions. You know, they're often missed out. And so they just don't feel represented, and they don't think that things like this are going to work for them. So, I mean, I was in a talk earlier today where people were saying that GPs are seeing that it sort of in the white communities, it's only 2 or 3% of people who are resisting the vaccine at this stage, but with BAME communities, up to 20-30% of people who are turning it down. So you've got to be aware of that emotional aspect of it. And so when you're approaching people, be aware that you don't want to escalate the argument. You don't want to make them feel even more in a corner. They'll just dig their heels in even more. So just it needs to bear that in mind. Something that we've been looking at recently is to also bear in your mind that people might not have the language to communicate why they're so fearful and reluctant to have the vaccine, but that doesn't mean that they're inherently wrong to feel that way. You know, you have to not come in and expect them to understand everything you're saying. And it's such a challenge because we come in and we think we know all the answers, but you can't expect someone to understand everything that you are trying to express. We're saying that we need to be patient and clear about the limits of our own knowledge and sort of the limits of the knowledge of science maybe at the moment, and also acknowledge the possibility of mistakes on the part of authorities. Don't go in saying that everything has always been hunky-dory, because we know it hasn't, and that's not going to make them feel any more comfortable. So acknowledge their fears. And one of the examples we've given is with conspiracy theorists, there's a feeling sometimes that it's about people trying to take control of them. So the thing with the microchips, and maybe you won't feel that there is microchips in it, but you can understand that loss of control. You can understand those feelings. So you can empathize at that sort of level. Another thing that we sort of talked about before is what would you rather see? So how do you think you can resolve this? So talking to people like, if they don't want the vaccine, how do they think we get out of this? What do you think their solutions are? It's just about starting that conversation. And a lot of the way, you have to bear in mind, you're not going to change someone's mind in a single conversation. You're not going to change someone's mind with a single fact, but it's starting that conversation and planting that seed for someone else to build on. It's like smokers, you know, they get told a fact once, and that you don't give up smoking the first time someone tells you you're going to get lung cancer, but it plants the seed, and every time someone says it to you, every time the GP says it to you, it builds in again and again, and eventually one day there's just enough information, you've kind of gradually made that decision. And that's all we can really hope to do, is sort of gradually build up that information for people. So yeah, that's kind of where we're at the moment.
Yeah, if I could just add to that, I completely agree, absolutely. And the thing that I thought when I heard the question was absolutely the idea of empathy, is understanding that people can come to these positions for lots of different reasons, and it's very easy from the outside to make assumptions about what those reasons are, and to box them into, well, you're vaccine hesitant or you're an outright anti-vaxxer and you believe this, therefore. But if you don't actually spend the time to listen to what they actually believe, you end up writing them off on a straw man version of their fears, and you're not in any way equipped then to answer the fears they actually have. So I think one of the things that I talk about when I talk about these issues is to actually listen to the people we disagree with, to understand where they're coming from, and also understand the details of what they are saying that persuaded them, and also what they're saying that persuades other people. Because if we listen to even the most extreme anti-vax conspiracy theory voices out there, as hard as it might be to sit and listen to some of the most extreme misinformation out there, we then arm ourselves with all of that information. So when we meet someone who might be on the cusp of being persuaded by it, we're not hearing it for the first time. It's something we've heard about, we've thought about, and we've developed counter rhetoric strategies to be able to pick, so we're not having to pick holes in that argument in real time.
I'm going to bring in some questions from our participants. So the first one is from an anonymous viewer. Perhaps, Richard, you might be the best to lead off on this one. Are the Sputnik Russian and the Sinopharm Chinese vaccines safe and effective? I do remember some talk a few months ago that there was lots of propaganda and misinformation in Russia regarding the Oxford AstraZeneca vaccine, and that they thought it would turn people into apes, was one of the most wildest conspiracy theories. I think we've now vaccinated several million people and not a single one has turned into apes. So I do hope we might have dispelled that particular conspiracy theory at least. But can I throw that open back to our panelists? So that is on the Sputnik and Sinopharm vaccines.
Yeah, so I mean, I am very keen to kind of outline whenever I talk about vaccines is that I am not a vaccine scientist, so I study people's perceptions of vaccines. So I think that's probably a Miriam question. But like I did know that they released their data on well, the Sputnik data did come out, didn't it? And it seemed effective. Yeah, I don't know, but like I know that there are many individuals that will be studying this, and if it is ever brought into our programs here in the UK, you can rest assured that they have done their work to check whether it is safe and effective. But I don't know, it'll have to be, yeah, that's not my area really.
Has anyone else of our two panelists had much
No, it's
information
really
about
not my area either.
Like I said, I know the pseudoscience better than I know the exact science, unfortunately.
Okay, we'll
well,
move
maybe
on.
it was, maybe I was the closest.
Okay,
Yeah, I don't know. We'll see. We like, you can't hide the data forever. I mean, it'll come out. We'll see how effective it is. It probably is effective. Like we had our vaccines for use in this country. We had them pretty much finished within the first couple of months of the pandemic. It was just the testing of them that took so long, and because we want to make incredibly sure that these things are safe and effective. But it seemed like potentially the Sputnik vaccine didn't go through that rigor, which is concerning, and that's what we want to do. We want to show that these things are safe and effective. But actually, most of it is just the effectiveness testing, really. Like we can be pretty sure of the safety quite quickly.
Okay, moving on. Our next question is asked by Rory, who would like to answer this live.
Yes, hello. Sorry, I'm just going to bring up my question. So there's clearly a desire amongst the worried about the vaccine to find information. A lot of them go online to find it. So my question was, how do we best capture their attention, especially if they're going in with a largely uncritical eye, or if they're going in a kind of echo chamber kind of way? They're going into these areas that they already are maybe a part of, if they're part of the homeopathy crowd, or if they're in alt medicine, then they're already going to have these arenas that they look for their news in. So how do you have any opinions on techniques for capturing these people's attention, presenting an alternative viewpoint to the ones that they're seeking out? Yeah, I think that applies to, I think, all of you in some capacity. So yeah. that's my question. And thank you very much for appearing. It's great to hear about all your work.
What we're finding is like the messenger is the message, really. Like, it's got to be from a trusted source. Like, that's how you capture the attention. Like, it doesn't matter how good your information is if you are not a trusted source. So like trying to find out who people's trusted sources are is basically what we try to do. So like a lot of our work is, you know, like trying to identify, especially within ethnic minority groups, who their trusted sources are. So that might not be the NHS. And so we've got to try and find who those sources are. And sometimes it's a religious leader. So getting a message through those networks is how we change minds. But like, if they're just going online, people curate their environment so easily there that it is so hard to kind of penetrate that. And it could actually make things slightly worse sometimes if they already have quite strong distrust for you as a source of information. So I have no solution for you.
Yeah, I guess from my side, the work that we do is probably the flip side of that to some degree, is to try to stop the places that are propagating misinformation doing so and reaching their captive audiences. So that's why we're actively monitoring the Facebook groups that are spreading misinformation and reporting and having taken down some of the source of information. And also we work with the media to publicize some of the worst cases of it. So if somebody is on the fence and might be unsure, they can see from various sources, some of them quite authoritative sources. It might be we had a piece in the Telegraph recently where the World Health Organization put out a quote on a particular piece of misinformation that we'd found from a homeopathy charity. And what we're hoping then is that the people who aren't directly going to that homeopathy charity's Facebook group and seeing this misinformation, but they are seeing the Telegraph or they're seeing those stories itself being shared on social media, that will help them frame the how to see that misinformation, how to judge that misinformation. So if they aren't just encountering it in the wild, they're encountering it first with a World Health Organization points out how dangerous this is tag, then hopefully that will dissuade them from tipping over in the direction of that particular piece of nonsense, unfortunately.
Is that pre-bunking?
I was literally about to say.
Yeah, right.
Pre-bunking.
Yeah.
That's kind of what we kind of focus on, is that sort of priming people and giving them the tools to look at it, so that when people advance for the likely kinds of misinformation, so that they can know what to look for and how to spot that sort of fake news. So I guess we're not really at your stage, Rory. We're a couple of steps behind that, but we're about making sure that when people see that, they can ask for evidence on both sides. As I said before, whether it's about pro-vaccine or anti-vaccine, we're keen to just give people the tools and encourage them to be like, okay, what's your evidence? Where's that come from? Is that peer reviewed? Or at whatever level, maybe you're not ready to ask if it's peer reviewed, but you're ready to ask, where have you got that from? Who's that source? Is it Karen on WhatsApp? Just a little bit of pre-bunking for people. Pre-bunking light.
Okay, I'm going to bring in our next question, which is from Lucy Tong. Would you like to come to the camera, Lucy?
So, just very briefly, context. I'm one of the people who got who, as a result of the swine flu vaccine, has narcolepsy. Basically, my question is how can the people who are responsible for messaging around vaccines make sure that we are they're as transparent as possible about what the possible risks are, albeit how tiny they are, without basically alienating those people who are already vaccine hesitant? Because my experience has been that I'm very pro-vaccine, but the people who are close to me, who know what happened to me, are understandably worried, and kind of how on a bigger scale we can be really transparent that these things do happen on a very, very, in the kind of the absolute minority of cases, but that risk can be there without it scaring people into not having them. Basically, what's the balance is essentially my question.
Yeah, I was shocked the first time I heard about the narcolepsy and the swine flu vaccine, but yeah, like, it's a genuine thing that I think some people in kind of the science community don't think that's a genuine relationship. So it must be quite frustrating for you to kind of tell people that it is caused by the vaccine, which it actually was. There were a few cases of narcolepsy that did come from this big vaccination campaign, especially being pro-science. That must be such a kind of an issue. I really feel sorry for you for that. That's hard. That's very hard. Yeah, I don't know how to communicate effectively. I think being transparent is best way. So like, if you're going to maintain trust in our institutions, you have to be transparent. We can't hide this. If there does appear to be a signal of a very severe adverse effect from any of these vaccines, we have to come out and we have to be very transparent about it. Otherwise, people aren't going to be trusting us again in the future. Like, you got to take that knock now and say, you know, science is good, but it's not perfect. But we admit when we've made mistakes and we're trying to do better. I don't know.
Yeah. So we have our All Trials campaign, which I think I mentioned earlier, which is about promoting people to publish all the information from the trials, regardless of good or bad, because it wasn't being published before. If it didn't go the way it wasn't wanted, people didn't publish it, and it really messed up the figures. And so sort of your GP didn't even have access to these trials and all this information just because it hadn't been published. So as you said, it's about transparency. It's about just making sure that all of the data is made available, and then making sure that it's communicated in a way that is accessible for people. But the transparency and the access to that data is the first step, because if it's not transparency, the data isn't there, those of us who can communicate the data, who can whittle it down for you and put it in terms that anyone can understand, if we don't have the data to begin with, we've got nothing to work on.
Yeah, and I think that putting the data into context is key as well, because obviously you can say how many cases there were who got even particularly unexpected side effects and particularly difficult side effects. But obviously we have this kind of bias, the bias of the near, where if we can come up with a particular example of a thing that feels a lot more common than all of the times that thing didn't happen. So anything we can do to illustrate that this is the case that happened out of this many cases, and this many people had 0 side effects, and this many people had very mild side effects, to try and help people contextualize how much of a risk they're actually at, especially compared to the comparative data on the risk of the disease you're actually trying to present. And if you can present both of those together, perhaps you can get people to choose the lesser risk on it. But yeah, it is tremendously difficult because we're so hardwired to use individual anecdotes as the way that we see the world, and we're not we didn't evolve to handle data well, unfortunately. Yeah.
Thank you.
I'm going to come to a next question, which is from an anonymous viewer who stated that they previously were skeptical or at least hesitant of the COVID vaccine, but have over the last few months been reassured. Do you think the people who are still opposed / hesitant are the sort of core anti-vaxxers, and there might be no way of changing their minds now?
Well, if I could begin on that, I don't think that's the case. I don't think we're at a point of core anti-vaxxers yet, because the vaccine rollout is still so recent, because the vaccine development is still so recent. It's I think when the vaccine's first released, it is probably not unreasonable to have questions. I think the more information we have, the more data we have on the safety of it, the fewer questions I think people are likely to have. And I think as time goes on, hopefully we'll see more and more people who are still on the fence, a bit unsure, especially as Richard was saying, when it's incredibly convenient, when it's, I'm not quite sure, but it's right here, and this will mean that I get to hug my grandma in 3 weeks' time. I think that's going to put people in a position where they're much more likely to have more trust in it once it's actually available to them. I personally think we're still some way before we get just to the hardcore. I think there is obviously a hardcore people there that unfortunately we aren't going to be able to reach easily, quickly, if we can reach them at all, to persuade them on this particular issue. The most we can do is to limit the spread of their misinformation so that they don't infect people further and persuade people away from the vaccine. But I still think there's plenty of people who are hesitant, who will follow the data as more and more information comes in and becomes more accessible to them.
I think as well, I mean, those of us who are sort of our age, some exceptions, haven't been offered the vaccine yet. And so we're not seeing our peers receive it either. So it is peer pressure, but as our peers receive it and we see that they're not having adverse effects, rather than just the grandparents or parents, I think that there will be people who become less hesitant just by sort of peer pressure as people start to go out into the world, and maybe they'll still remain hesitant, but they might also have the vaccine, so they might still feel it. But I think, yeah, we're a long way off just being down to those core anti-vaxxers. I think there's a lot more, and there's a lot who just want to see what happens to other people before they make that decision, and we haven't seen yet. Well, they haven't seen yet.
I think what concerns me still is kind of tight-knit communities that are, you know, living close together in the real world. So something like the Orthodox Jewish community in northeast London. Like, it can be easy for us to say that the message is getting through and everyone is kind of on board, but there are some communities that we just don't really kind of have that confidence that the message has got there yet. So like an anti-vax belief on its own, if you're just someone in a, you know, quite well-off community in you know, like rural somewhere or other, Somerset, isn't going to start an outbreak. An outbreak is going to occur when there's a community that all share a similar belief. And that's the kind of thing that worries me. And that's the kind of thing where attention is still needed. And like, it is concerning, even in the data that I was looking at this week that we're going to be releasing soon, it's in healthcare workers, there are more Black and ethnic minority healthcare workers refusing the vaccine than white healthcare workers. And when you control for kind of socioeconomic status and the job role they're in, that that relationship still exists. And, you know, it's concerning that, you know, yeah, we need to be able to get messages to these communities better. And I think actually, like, I know the media gets a lot of criticism when it comes to vaccine communication. Like, historically, they have not been great in this country. But, you know, they've really done well this time of, you know, bringing those issues to the forefront and getting, you know, celebrities in say, you know, Southeast Asian communities, celebrities coming out and actually doing the messaging on this is absolutely essential. And like, I can't do that. This can't help that solve that problem. So, you know, we need to, it's not just a kind of combination of words, like a correct combination of words in the correct order that's going to change people's minds. It's the people that are able to communicate these messages. And, you know, like, once we get that sorted, yeah, then we'll be fine. And, you know, like, it's like, from our survey, it's only about, I mean, it sounds a lot when you look at the numbers, but it's about 2% of the population are the very extreme anti-vaxxers, and we can get by on a 97% uptake rate for sure. Like, I think for something like COVID, you know, as long as it's, you know, not clustered people refusing it, we can get by on about an 80% uptake with this vaccine, because the vaccines are so effective. Well, hopefully they're effective in reducing transmission, is what we would want to be able to get herd immunity. But so we can get by without everyone, which is a relief, because I'm terrible at changing people's minds. So, that's what I'm relying on, yeah.
Okay, I'm just going to group a couple of questions together, because several people have asked around whether vaccines ought to be compulsory and around your feelings about vaccine passports. So perhaps, Michael, you might want to lead us off on this.
Oh gosh, I'm not sure I'm the right person, but I'll give it a go. From a policy point of view, I'm not sure I can really say a huge amount about whether I think they ought to be compulsory. What I do know is that what I do suspect is that there are people who would be hesitant, who a compulsory vaccination would knock them into a category of, actually, I wasn't sure and now they're forcing me to have it. Now I'm really not sure. So I think it can have a backfire effect there. But obviously, if it is compulsory, then that backfire effect may well be covered by the fact that people are going to be made to have it. I know, for example, Australia, when they were going through various, I think pertussis was actually the one, so Richard probably knows a great deal about it, but they had the no jab, no pay and no jab, no play. So various childcare benefits and other kind of benefits in those areas, play school kind of things, were tied to your child being inoculated. So you don't get your child to be part of this scheme unless there's an inoculation. And I think that was remarkably effective. Is that right, Richard? I can see you nodding, so I don't know if you know much about it.
I don't know. Like, So obviously, yeah, there's kind of different kind of levels of mandatoriness of a vaccine. So like you can tie it to benefits, and you can take benefits away from someone if they refuse to vaccinate. And so it works as a kind of a nudge policy more than anything else. So mandatory isn't like someone kicking down your door and vaccinating you. It is some sort of policy to change your decision around the vaccine. So it's aimed at trying to overcome people's complacency to vaccination. And like we discussed this a lot maybe about 2018 when there was outbreaks of measles in Eastern Europe quite badly. And I know that that's when Italy and France brought in kind of tougher vaccine regulation of linking these things to kind of payments and stuff. But it's a very difficult decision that the governments have to make, is, you know, like, at what level of uptake do you start bringing in mandatory vaccination rules? So I am against that. We don't do that in this country. We, you know, get by on trust, and we try to maintain trust in the system. What worries me about mandatory vaccinations is when we say that, you know, like, it sounds like a really good argument to have healthcare workers be required to have the vaccine to work in the health system. That sounds like something we would kind of say is kind of a no-brainer. We should do that. But what terrifies me is the doctors and nurses that would kick up such a fuss if that happened. So if you're a doctor and a nurse and you don't want to take the vaccine, and it becomes mandatory, and you lose your job because of that, and you start getting loud about it, then the public is seeing someone that works in the healthcare system turn against vaccines, and they are dangerous actors in, you know, misinformation when that occurs. So I personally know, like, we can't do that here. We can do it without it. We're particularly good at delivering vaccines in this country. We don't need to do a mandatory vaccination policy, is mine. But like, I'm naive, maybe we do or something.
But I guess it's also a case that any punishment you tie into refusal to vaccinate only ends up, or is more likely to end up falling on people who are already disadvantaged in some way. So if you make benefits reliant on a vaccination, then you're doubly punishing someone who is on benefits and then can't have that. So you end up putting people in even worse positions. And I don't imagine that has people come out of that feeling any more likely to listen to what the government says or wants when they're put upon that kind of way.
I mean, let's talk about incentives before we talk about making things mandatory. Like, it is possible to incentivize vaccine uptake, but then you're bringing money into into vaccination, and that is always a bit risky.
Okay, I'd like to throw the next question over.
Oh, there was passports as well, wasn't there? Sorry, we
yes,
didn't cover that. I know someone would be annoyed if we didn't cover that. But I don't have an opinion about the passport.
That's great. Let's go back to the question that I've got no opinion on. Brilliant.
Take it.
Do either of you two have opinions on passports?
I can't deal with it. I can't.
Yeah,
I suspect there'll be a necessary evil that we'll have for a short term. I mean, I went to Brazil in 2019 to do a talk, and I had to be vaccinated for yellow fever and had to have proof of vaccination on the way in. So vaccine passports already exist for many different countries and many different viruses. It's just we'd be adding ourselves as one more country, one more virus. So it sounds like a huge thing. It's maybe not as big a thing as we think, but the further ramifications I'm not qualified to speak to.
I'm going to bring in another question. So I'm going to go to James Cardis. Would you like to come on screen to ask your question, please, James?
Okay, I might be unmuted, but I can't seem to put the video on.
We can hear you, so go ahead.
Okay. Well, thank you so much for answering all the questions so far. I actually found myself caught unawares in a conversation with a colleague who is a homeopath and very opposed to vaccines. And I didn't really know how to approach the conversation, but actually Miriam's advice earlier and Michael's words have actually helped me out a lot there. I feel a bit more prepared. Oh, there you go, the video's working. No, my question was actually not too dissimilar from the earlier one about the Russian vaccine and its effectiveness. But in some of the news stories I've read, it compares different vaccines made by different companies based on numbers of, trials show it's protecting this percentage of people, and you know, for some of them that number is higher, and for some of them they can be stored in better conditions. And I just wondered, from the perspective of the panel speakers, if you've seen any evidence where people might be opposed to taking one particular type of vaccine, as opposed to, you know, maybe I want to take this one because it's from Oxford or something like that, which obviously means that the number of vaccines that the country's bought for the people living here is suddenly shrunken down. I don't see any evidence that is the case, but I just wondered if that's something that you've come across.
It's not something I've come across directly, but I'm sure it does exist.
Yeah, I mean, like you're right about some people having a preference for a vaccine. Like there is that preference for the Oxford vaccine, which is a bit annoying. Like I think the messaging around this has been quite good. Of if you are offered a vaccine, take the vaccine. Like people do care about efficacy, so how effective the vaccine is, and people have been making decisions based on that and wanting, you know, a more effective vaccine. But yeah, like I know doctors are sick of being asked which is the best vaccine. But like I haven't seen anything data-wise, but it doesn't mean, it just means I haven't looked at those questions really.
Yeah, I've not seen anything, but the majority of the places I look, they think none of the vaccines are effective. They aren't arguing about which ones are. So I'm on a very edge of the spectrum here.
Do you reckon these conspiracy theories are centering around specific vaccines, or do they have like a more general?
It very much depends. I mean, some of the more fringe conspiracy theories don't really think there's a great deal of difference between the vaccines. They think they're all coming out of the same big pharma, one world government, new world order type thing. So there are some people who believe that the vaccines differ only in name, and the availability of different vaccines is just to stop you questioning the very concept of vaccines. You can say, well, this one's better than that one, but that must mean this one actually works. So I think there's a very broad range of what people think, but I don't think there's anybody that I've seen in those areas who would say, well, the Oxford one, that obviously doesn't work, it's Pfizer all the way, baby. That's not kind of the spaces that I've been operating in.
Okay, I'm going to bring in Sylvia, who has a question firstly for Miriam about education. So Sylvia, please come into the meeting if you can.
Hi, sorry, it took a second there. I was just wondering, Miriam, if you as an organization ever thought about promoting spreading awareness about the scientific method in schools? I'm a teacher, and I've noticed that I teach maths personally, and I studied political science at university, and I've noticed that we only ever talk about the scientific method in science, if ever there. So students then end up lacking an appreciation of the value of applying the scientific method of thinking to, in general, decision making, making choices, understanding what has value, what makes sense and what doesn't. And then maybe if we manage to do that with children at an early age, then we'll have a smaller number of adults to persuade later on. And I think it's easier to change someone's mind when they are 12 than it is when they're 26, maybe. I just wanted, that's not a question actually, it's just a comment. I'm Italian, and I agree that it doesn't make any sense to make vaccines compulsory, because Italy arguably is a more corrupted country than the UK is, but what ends up happening is that people just lie about it. We've had compulsory vaccines for ages. It wasn't just the measles, we had that I had to be vaccinated to go to preschool, otherwise I wouldn't have been allowed. And a lot of mums, they would just lie about it. So I don't think it works.
Yeah, so on the involving young people, so if you give the evidence hunters a quick Google, it's part of our Ask for Evidence campaign. It's actually something that my colleague works on, so it's something I've directly worked on, but it's an activity pack that's geared for, I think, 11 to 14-year-olds, but it might be a bit on either side as well, which gives kids sort of the confidence to assess stories and claims that they see online, and how do they approach it and how do they question it. It's just an existing activity pack. If you go on there and if you want any more information, I think there's the email address of my colleague, or you can email myself afterwards. I'm happy to share my email and give you a bit more information. But yeah, we are already working in schools, but it's one of those things is just funding, isn't it? Because we're a charity, so we're always limited. But that pack is completely free, and you can access that and use that if you want to.
If I could just speak to something there as well. One of the things I used to do back when we were allowed to move around in any kind of degree, I actually would go into schools and give lectures on the flat Earth as a way of encouraging critical thinking and scientific method. Because what I would do is give the first half of a lecture explaining all the ways we know for sure the world is flat, using all the ways that flat earthers would use as the most common arguments. And I wouldn't explain to the kids that I believed the world was actually round. I would present myself as a flat earther and see how many kids I could get to persuaded that the world was flat. And then in the second half of the talk would say, because I said question everything, let's go back over every bit of that, and let's hear if we can figure out what I was wrong about. And I found that was actually a really interesting way of getting students to not just question what they're hearing, but then try to figure out the holes in it and to navigate their way through. So I think, yeah, teaching kids to value science, to think critically is definitely vital. One of the things I do think is the case, unfortunately, though, is it's not really the younger generation that's the biggest spreaders of misinformation online. I think, and maybe Richard's research will speak to this more than I'm aware, but I think some of the biggest vectors of misinformation tend to be a little older, where you weren't digitally native, you were grown up before the internet really took hold and became a ubiquitous thing, and so it's not as natural for you to spot some of these things. So that's been my experience of the pseudosciences that I look at, and I don't know whether Richard kind of has any thoughts on that or not.
Yeah, I think that's it's those people that are quite new to Facebook that are falling for all the things that we fell for 10-15 years ago.
On that, am I allowed to ask my second question as well?
Go ahead.
Thank you. It's just because I have a friend who actually is skeptical about the vaccine, if skeptical is the right word, and she's not stupid. It's surprising to me because I know that she's not stupid, and yet I struggle. And she's my age, she's 30, and I have a feeling that for her, there is isolation in how she went into some conspiracy theories things. But I think that there's also the fact that she doesn't understand how arbitrary beliefs are. So we were talking about the possibility that there could be a nanochip in the vaccine. And I was like, well, you cannot prove that there is one. No one has managed to prove that there is one. And her answer was, well, but you can't prove that there isn't one. And that's where I get stuck, because how do you explain to someone that belief is arbitrary? Because, you know, if that's your reasoning, then how do you know that there isn't a nanochip in your orange juice or in tap water or in butterfly needles? How do you know? How do you make choices? So what would you do?
There's an analogy that I often use when it comes to how to have people to question their own beliefs, and it's maybe a little long, but if there's an asteroid going to hit the Earth, the worst thing you can do is blow the asteroid up head on, because then all the bits of asteroid rain down on you. The way you'd actually deal with that is to send something up with a bit of gravity to slowly change the direction of the asteroid over time. So the imperceptible pull of the gravitational force of this object will slowly change the path that it's on. And I think that's how you dissuade people from believing things that are untrue. You don't hit them head on with a big explosion, say you're wrong for these reasons, this is nonsense, but instead you hang around near them and just give them little bits to chew on, little ideas to make them think. And one of the things that I do is, rather than say this makes no sense for that reason, I say, look, I want to try and understand as much as possible, but when I try and follow you, I come to this hurdle. So could you help me pass this hurdle? Could you explain to me how you work this out? And when you're presented with this problem, does this seem like a problem to you? It feels like a problem to me. So how do you get past it? And if you're asking to collaborate on a journey through these questions, then people are much more receptive, because people are at their least receptive when they feel challenged. That's when the defenses come up and they just block everything out with whatever tools they can without really taking it on board. So trying to be little and gentle, and as Miriam said earlier, you're not going to do it in one conversation, you're not going to do it with a fact, but just staying around the person and being the person that they still trust and respect, and having these little questions that are presented not as challenges or aggressively, but as kind of just genuine interest in how they think about something, I think can have a more positive outcome.
Yeah, and as we sort of talked about earlier, the empathy aspect of it, so this doesn't really resolve in answering it, but it helps you get there and helps you drop that barrier down, is that a lot of the people who think the microchip theory might be real are worried about their freedoms being curbed. And you might not believe that, you might not think the microchip thing is an issue, but it is possible to empathize with the perception of loss of control over our lives, without actually getting caught into the details of the conspiracy theory. You can be there to empathize because we're all feeling a bit of loss of control. And so that's something that's, that's more deep set than the actual issue itself. The microchip is just an aspect of that. So that doesn't answer you on how to resolve it, how to get past it, but it's just something to chip away, something to, lay the foundation for someone else to build upon later.
And acknowledging that that loss of control explicitly, I think, is good. As we're all feeling this loss of control. I totally agree with you on that. That there's a lot of things going on, and our liberties, we aren't able to move, and it's scary and unsure. So I agree with you there. But then this bit of it, I'm not sure I can follow. So can you explain? So you lever away the sense of, and the emotion from the actual detail itself.
Sometimes it can kind of devolve into a someone sending you a whole load of links that you have to read through and look at all that information in a 2-hour-long documentary, and then you send back an incredibly well thought out argument with all of the evidence packed into it, and then it goes back and forwards, and you kind of end up nowhere. And so, like, what I started kind of trying to do in these kind of conversations is, instead of doing it on a kind of information level, do it on a trust level. So why are people trusting the people they are trusting? And that's something you can have a rational conversation about as well. It's like, so what makes up a trustworthy person in your eyes? Like why are we saying that these people are trustworthy and these people aren't? I much rather have that kind of conversation, because it's more, social, when it's more kind of the part of our brain that we're really good at is understanding who we should be listening to, rather than talking about all of the safety and efficacy data, which I never have that at hand, really. So, like, in a conversation, that's the best way that I've managed to do it.
I'm going to bring in as many questions as we can in the last 15 minutes. This one from Paul Co-Geek, I'm going to actually put to Michael. As with your experience with homeopathy, how can someone like Prince Charles be both an advocate of the vaccine and homeopathy?
Oh, that's an excellent question. I don't think, I'm not sure we're all consistent in our worldview. I mean, I'm not even sure that I'm consistent in my worldview. We're all dealing with a constant series of conflicting opinions that we never really fully rationalize, and we hold all sorts of cognitive dissonances in our head to keep our worldview straight enough to keep us walking a straight line. So I think that's probably a big part of it. I genuinely don't know. When it comes to publicly professed opinions and personally held opinions, and what the distinction is there, I think it's certainly a very good thing that Prince Charles has come out and publicly expressed support for the vaccine. I think that will have an effect on some people, and is a very responsible thing to say, regardless of what we think of Charles's opinions on anything else. I think that is a very good thing. But when it comes to something like homeopathy, there's something like 40, 50 GPs working within the NHS who are also homeopaths, who will do evidence-based medicine 90% of the time, and then pseudoscientific pseudo-medicine based on principles that are anti-scientific and couldn't possibly work the rest of the time. And they won't see a problem with that, because people like to put all of their beliefs together and find a way to make it fit. So yeah, it's no surprise to me that somebody even as well educated as Prince Charles holds opinions that are not internally consistent.
Okay, does any of the other two panelists have anything to add on Prince Charles and his many inconsistencies?
No.
Not touching that one.
Thanks, guys.
Okay, and then I might come to Amy Rosenberg, who has 2 points that she would like to make. So Amy, if you can come up, please.
Thank you so much for sharing. Well done, amazing work, and thank you for sharing some of that this evening. I had 2 questions, mostly for Michael. Really, I was scribbling away and making notes during your introduction. I feel like you really got an insight. So the first question was, how do I broach this with my mum? an alt medicine homeopath, who's also, she is scientifically trained, in sports medicine and physiology and that type of thing, but then simultaneously holds these other views. And also maybe a more general question for everyone about why should I get the vaccine as only 23? I'm not hesitant, but I'm just curious as to your answers. Thank you.
So yeah, in terms of how you could broach it with your mum, I think it comes down to what we were saying to Sylvie, that idea of not doing it in a confrontational way, not doing it in a way that could be perceived as being as righting a wrong, or as having a sense of superiority, or anything that it could be negatively perceived as, but trying to do it as gently as possible. And I would say it's not about trying to overturn all of her alt-med beliefs in one go, or at all. You may never be able to do that. It's probably very likely won't be able to do that. But to say, look, we would disagree on this, and we would disagree on this, and we can have those disagreements and still love each other and absolutely fine. But this is really important for this reason, and here's why I think this is particularly important. And try to single this one out so you can prize it away from the broader worldview. Because I think the longer that anybody, as long as anybody who has a very alternative medicine worldview gets to see this as them and me, and vaccine is one of them, then I think it's less likely they're going to take it. So anything you can do to sort of pull vaccines out of the fray and have it as a separate subject of, it's very scary right now. There's lots of people getting this disease. It's harming a lot of people. A lot of people aren't surviving it. The last thing I want you to do is to get ill. So, and start to talk at that kind of level, I think. But as much as you can do it in a supportive, questioning but gently, taking her on that kind of journey of your own thinking, and helping her raise genuine questions herself, I think that's the only way to do it. But I can appreciate it's incredibly tough, and I wish I had the perfect thing you could just say to her and she'd go and do it. Yeah, I don't know if other people have thoughts there too.
Yeah, I mean, maybe just like other members of the royal family, she might not need to go against any of her beliefs and can believe both. And so it's maybe not about approaching what she does believe, but just working out what is it, again, we've talked about before, what is she concerned about? What is her underlying fear of it? And always that question, and which I always think is a great question when it comes to this, is what evidence would you need to see before you felt comfortable? What is it? Because actually, half the time when you ask this question, that evidence already exists, and they may not. People have barraged them with all these facts and figures, and the one piece of information that they actually needed is the one thing they're missing because they're not looking for it. So, yeah, I think that's a good place to start.
Yeah, and the other question was, why should you get the vaccine? I think we should all get it. I think anything we can do to contribute to community immunity is a good thing. I'm lucky enough to be perfectly healthy, and I was very fortunate to get vaccinated yesterday, and I'm delighted that I was able to. So yeah, it's for everyone else and not for yourself even necessarily.
Yeah, and my argument for why anyone should get vaccinated is long COVID. Like, it is far more common than people realize, and it is common in younger people as well. So like we're focusing our survey quite a bit on student populations, and we're going to lecturers and department heads and asking for them to spread it to kind of their students, and a lot of them are coming back to us saying that, yeah, this is going to be a problem. Like there are a lot of students at the moment that are having symptoms that are lasting far longer than we were expecting. So like just self-preservation, it is worth getting the vaccine. You're not showing up in the statistics at the moment because you're not dying. That's what's happening with that age group. Like they're surviving when they go to hospital. But if that's the only stat that we care about, that's not good enough for me. I think we should also be caring about the stat of how many people are suffering from this virus. And we don't see that. We don't experience that stat on an everyday level. And I think that's the conversation that I'm going to want to get going a bit wider when we try to vaccinate these younger populations. We need that to be the messaging that kind of adds the kind of drives the incentive to get vaccinated, because I think people need to understand that they're not invulnerable to this virus if they're young. It's not that we're just protecting other people. We have to also protect ourselves here. But I'm scared of everything, so I don't know.
Possibly, we have 5 minutes left. I'm going to bring in one more question, which is from an anonymous viewer to all of the panelists, and I think it's quite an interesting question. How large a role should the government be playing in regulating misinformation on social media platforms, and how might freedom of speech affect this?
Yeah, it's incredibly tricky. I think one of the things we're seeing at the moment is there is very little role being played in stopping almost anything being said. I mean, the amount of misinformation that you can that we're seeing on Facebook, Twitter, across the social media landscape is huge, and we're just seeing, first of all, no government impact at all, because the theory being that these companies will take care of it themselves, but they're just not doing it. They're not taking it seriously enough. We saw that with Twitter, with the removal of Donald Trump, and then within 2 or 3 days, they saw thousands of accounts that they just turned off overnight because they knew you couldn't turn those thousands of accounts off overnight if you didn't know who they were already. So clearly they had a list of people or they had some way of identifying these people the entire time previously, and they just weren't incentivized to do it until the landscape changed enough for them to realize that this is something they're going to have to take account for. We aren't seeing on Facebook, I think, when actively, a lot of people don't realize Facebook went out of its way to promote misinformation. The rise of QAnon in part was because Facebook was aggressively recommending its users join QAnon groups, because the more time you spend on Facebook, the more time Facebook can serve ads, and that's what they were caring about. They weren't really looking at the content of the groups they were recommending, they were looking at how many people were using them. So the incentive structures for these platforms at the moment are keep people on there, keep people talking, keep people engaged, and not to tackle misinformation. I think something needs to change to shift those incentive structures, and if that means there has to be some level of government interest, in the same way that the government has a role to say what you can and can't say in advertising through advertising standards authority and various other things, then I think it's certainly something we should be looking at. What we shouldn't allow ourselves to do is to say, is to let the question who decides what's okay be an excuse to do nothing. While we spend our time arguing about where the line is drawn, the line is never drawn, and it's status quo free for all, which we've seen is perpetuating huge amounts of damaging misinformation.
We're concerned about spread through WhatsApp at the moment. It's not just in these public squares that we're seeing misinformation fly. It's people joining these kind of large WhatsApp groups about anti-vax, and it's also sharing family groups and community groups on WhatsApp. And I don't know what kind of strategy you can put into place for misinformation on WhatsApp, but it is concerning.
Yeah, so exactly the same. I think we saw the videos that were being shared, the sort of anti-vax videos, and they were on Facebook and they were on Twitter, and they were getting taken down from them for however they were. We know they're all for taking things down, but those ones were. And you did just make people bury deeper into those WhatsApp groups, which we can't have the government in that sphere. That's just that is a whole other step into people's privacy. So absolutely, there needs to be something done with the social media, but it is just going to go deeper, and it's going to dig its claws in somewhere else. I don't have an answer, but it's just it is a problem.
Okay, just being conscious of the time, I'm going to draw the questions to a close. There were some really good questions and some really good discussion there. I do apologise if we didn't get to your question. However, we just had some. I am going to bring in James, who's chair of Young Humanists, just to give a bit of a plug for the Young Humanists before we wrap up. So James, please come in if you can.
Hello, sorry, it's me again. You saw me earlier asking a question, but yes, I coordinate the Young Members section of Humanists UK, which is just the humanists which are between the ages of 18 and 35. That's all it means. We're a little bit underrepresented in Humanists UK, so it's nice to promote the Young Members. And it's the Young Members committee that have organised and promoted this event behind the scenes. And all of the online events like this are absolutely free for anyone to attend. And I hope everyone attending has found it as interesting and educational as I have. And these events, we rely heavily on the generosity of our very eloquent and knowledgeable speakers to give their time and expertise on these things. and also the people attending with the, like Rachel just said, very good questions asked. I was actually really inspired by Lucy's question earlier, given, you know, someone who's experienced one of those, you know, marginal side effects and still saying, you know, you can see the great positives that vaccines bring. I just wanted to just speak for a moment about becoming a member of Humanists UK. It's a small donation a month, and for that you get some nice goodies that Humanists give you. You get a nice newsletter that talks about all the good work that Humanists are doing in the country. You get an email newsletter so you don't miss events like this, and you get an online login for more information there. And what it helps for us is to actually fund some of the promotions so that we can get these wonderful people in front of as many people as possible and spread these good messages. So if you would like to join as a member, you can join up on our website. Maybe Rachel, if you could give some details on the joining details, or there might be a link that we can put in the chat or something. But other than that, I just want to say thank you again to the speakers, and thank you to everyone for attending and contributing such great questions as well.
Okay, thank you very much. I'd just like to say another thank you to Dr. Richard Clark, Miriam Kazan-Malarkey, and Michael Marshall. So just before I'll give them a round of applause, and thank you very much for attending this evening.